My name is Dr. Misbah. Today's video is actually a very exciting video. It's a great day for me. I have been granted my own trademark by the United States Patent Office on my very own technique for fat grafting. I have been working on fat for I don't know how many years, at least during residency that I started to work on different aspects of fat, diseases related to fat, the different kinds of fat physiology, the different types of fat that are distributed in the body, and how we can make better use of it if in case we have to do fat grafting. Now, fat grafting may sound like something very simple and mundane, that you can take fat out from one place and put it in the other. And I've heard many surgeons give talks and they refer to fat as so-called clay, that it is a clay in a sculptor's hand. There's some partial truth to that. I'm not going to deny it. But fat is a lot more than that. It is actually an endocrine organ, if you think about it. There is a lot of other aspects of fat besides being a storage unit for your body. Now, for the excess calories. Now, this technique that I have perfected took me so many years to actually be able to figure out a way how fat can be safely harvested, kept in its entirety the way it is supposed to be, without disrupting the cell membrane, without causing a lot of oil production or leakage from the fat itself, and keeping the fat in its native form as much as possible before you actually put it in a certain area, and how different kinds and different types of the fat lobules can be separated when you take the fat out, and what it should look like, and what it can do for you. And though all of those factors, they help to predict the final outcome. The reason why sometimes fat grafting is a little bit considered tricky is because there is a problem in terms of determining what the outcome will be. And in some cases, you get a very good take, and in some cases not a good take at all. I am not going to talk about the whole technique as to how I separate the fat at all. That's actually just my own proprietary technique that's specific to my office. But I will go through the basics, okay? The basics are sticking to the basics, okay? Number one, have a good harvesting site. That's number one, okay? And number two, yellow is good. If you're able to get the yellow fat, very good. That's wonderful. And red is bad. Red fat, you can count on it that that fat is not going to stay. So keeping in mind all those three aspects of it, and then I will go into some of the work that I have done using my technique. The acronym for my trademark for fat grafting is called Mini-SIF. And I have used this technique to rejuvenate faces, to use it off head and neck areas also, and in many aspects of my revision surgeries whenever I do surgeries that are related to fat defects and also some scars. So I will go through some of those cases with you as well. Let's just go through one of my star cases where I used my own trademark technique, Mini-SIF, to rejuvenate head and neck, in particularly the skin soft tissue and also skin laxity. So the word Mini-SIF, it stands for minimally invasive stromal fat, and injecting it for the sole purpose of volumization and also for the restoration of one's facial golden ratio, which is 1:1.618. And I usually take sometimes photos and then determine the golden ratio, and sometimes I would use a caliper as well, which I have one in my office that is a golden ratio caliper. And sometimes you could use the patient's own preferences as well, and also make sure that you're aware of it as to what the patient wants and what areas he or she wants to be augmented or not augmented, or is it solely for the purpose of skin rejuvenation and no volumization. But there are different aspects of it, but you have to just kind of get a sense from the patient as to what they want. But if there is any volumization required, then that will all be based on the golden ratio of the face. And then the F, it stands for the fractional lasers, which in my case I usually use those fractional CO2 lasers. I have 4 different kinds of fractionated CO2 lasers, and in any given case I'm at least using 2. And in this patient that I'm going to talk to you about, I use 3 different kinds of CO2 lasers all at the same day and same time. And so where can this technique be applied? It can be used any place where you can think of where your own stem cells can be utilized and wherever you need skin rejuvenation. And if those are the basic criteria, then this technique can be employed. And so I use it basically all the time, whether I'm fixing defects or I'm volumizing a face. If there is fat involved, then this is the way I'm going to do it. But there are frequent other, mainly it's used for like your facial rejuvenation scars and also sometimes for liposuction defects. And you know what? Many times in defects, I have scars and I have fat loss. So I end up bringing all of my knowledge from this technique, and this is basically how I fix my defects. Anyway, so let's just go through, this is actually how my tray looks like. So I try to separate my FAAD from nano FAAD into micro FAAD and also the macro FAAD, depending upon what part of the face or the body I am working on. I will need different sized particles, and so I just like to separate them out. It's not the cleanest photograph, but I wanted to show you that how I, just compartmentalize my FAAD based on the particle size. And so let's just look at our case. So over here you can see this is how the patient first presented to me. This is full makeup. This lovely lady, she she's from the south, where the sun is abundant. As you can see, you can tell from the neck and from the lower face also. But there's actually a lot of work that needs to be done, and not a candidate for surgery for several reasons. And then number two, she also did not want any surgery. So with that in mind, what else can be done where the physical cutting of the skin is not involved. So short of that, I mean, this is in no way a procedure that is comparable to a facelift or a neck lift. But short of that, how good the results can be, this is how it can be. So in her case, I actually did the full face global rejuvenation and including the neck as well. So I think neck came out just so beautiful. I'm really proud of this case, but especially without doing any neck lift whatsoever. I did not have to do any neck lift on her. So this is all non-surgical, non-skin cutting. I should say not non-surgical, but non-skin cutting. And so this is how she ended up looking. And so here is actually a very good photograph of how the lower face and the neck came out. The neck received 3 very heavy CO2 lasers that I treated her with. Now, mind you, if a person is not experienced in the use of CO2, just don't do CO2 on the neck. It is a very difficult area and the risk of scarring is very, very high. So if you're not well versed on the use of the CO2 lasers, don't even bother. But I've been working with lasers my whole life, and it's not for me, it's not that difficult of a thing. But again, you have to be mindful of it, that when you're treating neck with the CO2, things can go wrong. But other than that, the full face, the profile, and all of that, it got so much better after the technique. And so here, as you can see, like the temple area and how much that got improved. So I injected FAAD all on the outer edge of the face to recreate the entire new facial profile, as opposed to fixing it more towards the center. So that's what made the face look so much youthful. And I also did her upper eyelids. That also helped with the shape of the brow, and also a little bit on the lower eyelids as well. And then there is FAAD all the way here underneath the skin. It's also, I made her chin a little bit, lips, everything. This is all FAAD, and of course lasers. And so this is actually one of my star photos. I was really happy for her because she was, telling me when I first met with her, she was like, I used to have such a cute dimple over here, and now it seems to have disappeared. And I didn't even think of it, but then when we were going through her after shots, she pointed it out to me that, oh, you know what, Dr. Khan, you gave me my dimple back. And, believe me, that was not my intention. It just kind of happened. And let's just call it a happy accident. She's happy, and the neck came out really good, and I was very happy about that result, and also the jawline and all of it. So now this is like more of a head and neck application of the Mini-SIF. But what are the off head and neck or for the lower body, if in case I have to use this procedure, which I frequently do. So I'll show you one of those cases. This is how my macro FAAD looks like. So larger size particle, but as you can see that there is not even a drop of blood in any of these. 30 syringes. This is 30 ml each. So if in case I'm doing a buttock augmentation case, or if I'm doing like any other part like a labiaplasty, or if any other areas that require quite a bit of that, then this is the size particle that I'm going to be using for that area. And you can see that, you know, each and every particle has to be a specific streamlined one size particle, whether you're dealing with nano or micro FAAD or macro size FAAD particles. They just have to be one uniform size, and that's the key in FAAD grafting. There's no oil here, there is no blood here. This is not a centrifuge process at all, but this is my own MiniSIF technique. And so here is the photo that I wanted to share with you. The outer thigh defects due to smart lipo. As you can see, we have scarring from the laser, we have indentations from the laser, and also too much fat that got melted away in a certain point, and then also causing a little bit of a pulling of the skin in certain areas, and then a lot of folding. And I took this photo intentionally under a strong light because that light highlights that folding effect that people sometimes get due to those indentations of after the liposuction. So this was a perfect case for me to actually work with the MiniSIF, because I not only was able to correct the indentations with the help of the FAAD, but I also treated her with the laser and got the skin texture to be improved, and also a lot of the scarring to make it go away. So as you can see, the scar got so much better. So here's like one of the really good cases and situations where the MiniSIF can be used on an off head and neck situation. So those are two really good cases that I just discussed with you, and I showed you the results of the patient who needed facial rejuvenation, the neck, and also the off head and neck use of my technique of MiniSIF. So that's the versatility of the whole process of the way I do fat grafting, and also combining it with the use of different kinds of lasers, especially the CO2 laser, which is my workhorse. I use it almost practically every day for so many different things. But when you combine the two together, you can actually achieve a lot of great results, and great things can happen for a patient. You do not necessarily always have to cut open, especially if the patient has been through so many surgeries in the past and they're not great candidates for further surgery. As a matter of fact, if doing additional surgery can make things worse for them, or if they are not in a good physical medical state to undergo another surgical procedure. For example, if they may have like a blood clotting disorder, or they may have problems with smoking, or they may have issues with some other maybe there is a recreational drug abuse problem, but you just have to know those kinds of things before going into a surgery to make sure your surgery has a good outcome. And if a patient is not a good candidate for it, there's so many other things that you can do, and you do not necessarily always have to rely on fillers and Botox. That's another point I wanted to make sure that I wanted to have it come across, that there are things that can be done that are not necessarily going to look good on you, but they will also be very, very good for you in the long run. The results will last you for a very long time, and that people will definitely compliment you, not because that you look different, but because they will not be able to tell what you did, and because you will look so good. So I hope you found this video very helpful, and I am proud of it. I'm really happy because, oh my God, after so many years of working with fat, finally I have a trademark, and so I can make it better from here on and continue to provide better care for my patients.